I'd like to first thank the Executive Leadership Team of Hospital Sisters Health System, or HSHS, for taking the time to discuss this important opportunity. Hospital readmissions are a significant problem across the country, and now with CMS enacting withholds, there are substantial costs associated with readmissions. Internal analysis shows that HSHS stands to lose around $25 million in CMS revenue if the system is unable to reduce readmission rates by the 20% necessary in 2015. The challenge with readmissions programs developed in the past have always been the limitations of effectiveness. HSHS can only control what occurs within the hospitals, and they have little to no control in the ambulatory environment. Today, however, there's a real opportunity to coordinate patient care that extends beyond the hospital walls into the ambulatory environment by developing a system-wide readmissions contract with the Physician Clinical Integration Network, or PCIN. HSHS has a unique opportunity to contract with PCIN around reducing readmissions to achieve the CMS goals. This is truly an innovative opportunity for HSHS to turn a $6.5 million contract investment into $19.5 million in net realized revenue. And I'll explain how this can happen. There are two specific process measures within the proposed contract. The first is called Reduce 100. Reduce 100 is a quantitative systems process measure to reduce 100 all-cause readmissions across the entire health system of HSHS. On average, there are 500 readmissions a month across the system at a cost of around $18,000 per readmission. The Reduce 100 would potentially take out about $1.8 million in monthly readmission expenses. The second process measure is called NN7 and is a network process measure to track and increase the number of patients seen within 7 days post-discharge from HSHS hospital. PCIN, based on inpatient data, has a connection to over 73% of all inpatient cases within HSHS, and this creates a strong case for the coordinated efforts. PCIN, as a clinical integration network, is a safe harbor under the Federal Trade Commission antitrust policies, and as such can enter into contracts to improve quality, reduce costs, and share in the savings created with no financial downside risk to PCIN. As a result, PCIN and HSHS can work together to structure a contract that provides payment to physicians who achieve against the above referenced measures. To achieve these goals, the PCIN Board of Managers will develop clinical guidelines to address how they manage discharged patients and in many cases aggressively follow up patients as well to provide an appointment within 7 days post-discharge. HSHS as a system will need to improve internal processes and coordinate with the ambulatory physicians and improve timing of discharge notes to ensure patients leave the hospital with preset follow-up appointments as well with clinicians. So how does HSHS turn $6.5 million contract into a $19.5 million realized revenue stream? The breakdown is as follows. The contract expenses are $4.5 million for the Reduce 100 metric, which consists of a $4,500 payment to PCIN for each readmissions avoided above a baseline from a baseline of 500, and then $1.5 million for the NN7 metric, which results in about a $6,250 payment for PCIN for each 1% increase in discharged patients seen within 7 days post-discharge. There's also $500,000 for program development, including marketing, training, and additional IT support. HSHS can realize $19.5 million in revenue by contracting with PCIN to reduce avoidable readmissions. Essentially, it's the $25 million at-risk revenue less the $6.5 million payment under this proposed contract with PCIN. Readmissions continues to be a significant problem across the United States, and HSHS is not unique in this regard. HSHS, however, does have a unique opportunity to reduce costs, avoid penalties, and improve quality of care by investing in a $6.5 million contract in PCIN and netting $19.5 million in revenue annually. Thank you.